All right, so this is a medical personal health record system database that I designed using Ninox on a Macintosh Mac computer, which is also compatible with iPad, and they will sync via cloud to each other. So if you want to enter information when you're home on your desktop, on your Mac desktop, it will sync to your iPad for when you're at the doctor's. You can call up the same information. Whatever you enter on the iPad at the doctor will automatically sync to your Mac when you get back home. So right now the database is completely empty. I'm not going to show you my actual database that has my records in it. So first thing we got to do is we need to add a patient. So we're going to go ahead and click Add New Patient. That brings up our main menu for the patient. All right. Let's see. I also want to. Okay. So the first thing I'm going to do is go to the first name and enter a name. We'll just use my dog's name for now. Actually, no, we're not going to use my dog's name for now because we're going to show you that in a minute. We'll use Dream Finder. Dream for his first name, last name is Finder. So now we have a patient named Dream Finder. You could enter the date of birth, but it only goes back to the year 1901, and so which is 123 years. So say we wanted to go January 1st, 1895. Oh, I guess it did go back all the way. Okay, my mistake. You could enter their social security number if you wanted to. You can enter their phone number. We'll just go 8675309. Just hit enter. Do not put spaces or dashes when you're entering the phone number because it will mess up the format of the phone number. And if your Mac is hooked up with your iPhone, you could actually call them by clicking on the phone icon. We could enter an email address. We'll just put none@none.com. Again, you could also click and send them an email. Then you select if they're male or female. We'll go male. Then you can put in their address. 123 Main Street. In the city, we'll put USA. Now it has all the states and also as well as Puerto Rico, any outlining U.S. territories. So we're just going to pick Florida, and you can enter a zip code. You could also, by dragging a picture over, so I'm just going to grab any photo, drag it over, add the patient's picture. So now we went back to our list of patients. We now have a current patient, last name Finder, first name Dream. All right, so let's go back into that patient. Now, obviously, we're going to need to enter some doctors for this patient. Now, every patient has their own set of doctors in the database. So if you have multiple patients in this database, you will not be able to call up doctors that you were assigned to one patient with another patient. You would have to enter the doctor's name again. So we're going to go ahead and go into provider menu and add provider. So we'll go, the doctor's first name is Figment. And we'll give him last name of Imagination. Okay, if they're part of a company, a global medical company or whatever, you could enter that if you wanted. Again, we enter a phone number. 675-309, which is just going to be the phone number we're using for the demonstration purposes. If they have an extension, you can enter their extension. You can enter their fax number. You can enter their email at vaccinations.com. These are fictional phone numbers and emails, so don't even try to contact them. They're all fictional. They have a website. You could enter in their website, and it would take you to, if you clicked on here, it would take you to their app website. In fact, I'll demonstrate that. We'll actually put in apple.com. Now, if we were to click on this, and it opened up on one of my other monitors, it actually displayed the website that we clicked on. Do they have, if they're part of a certain clinic, you could enter that. Then you can enter their address again. If they have like a suite number, you can enter that. And we'll go Orlando, Florida. Now, this state is not a drop-down box, so you do need to actually put the abbreviation in this one. And the zip code. And if they're a specialty, you put whatever specialty they are. We'll go family, or we'll go actually primary care physician. All right. Now, if there's a special copay for them, you can enter that. Actually, that's not, why is that not working? Huh. I'll have to check why that's not working. And if you had any notes, you could enter the notes. So now we'll go back to the client for a second. All right. You notice right now it says no future appointments scheduled. It also says there are no appointments today. This will update automatically based on information in the system. So let's go ahead and we're going to go ahead and go back to provider, because the easiest way to do it is you can do it two ways. You could go to visit menu and add a new visit. And then you can select the provider through here. But it does not auto-populate certain fields if you do it this way. So what I like to do is go into the provider's menu, click the provider that I have an appointment with, and then hit schedule visit with provider. You notice now that auto-populated the provider's name. And what it does not auto-populate the other way is if you click on provider's address, it will not auto-populate the provider's address in these fields here. If you do it the way going through the provider and scheduling the appointment, it will auto-populate their address. And then we're going to pick a date. We'll pick today, just so we can demonstrate that. And we'll go 4 p.m. And reason for visit, we'll just say test visit. Now, you notice it does automatically capitalize everything in the reason for visit. We will get back to why the system does that later on. All right. Then you have appointment type. You have office, you have telehealth, or a remote device check. If you have something that the doctors can, like a pacemaker box or whatever, that the doctor just remotely checks, and you know that when they're going to do it, you can enter that there. For this one, we're going to just leave it at office. You can enter a schedule length if you know it. It's not a required field. All right. You can enter if you have a copay. We'll get back to that. So right now, this appointment is scheduled. So we're going to go back to patient. Why? Oh, because we were in the doctor's. Why? So You can go click back to patient again, and now you're going to see, if we go to visit menu, we're going to see that we have an upcoming appointment here. We can also go back to the list of patients, and you notice that these have changed. It now says there is one appointment today, and also it says here there is one appointment left for today in case you have multiple appointments or multiple patients, and it will list the appointments for today. Now, when you get to the doctor, you can, from this main menu, you don't have to go into the patient. You could if you wanted to, but it's as easy to click on the appointment that you're actually showing up for, and it will bring you right to the appointment window. So then you're going to go ahead and you're going to click that you checked in. All right. And now these fields down here auto-generate how long you've been in the doctor's office. All right. So now let's say they took you for lab draws first. So you're going to hit a time that you were taken for lab draws. Okay. Now it says we waited 5 minutes to be taken in for labs. Now this will not automatically update if you're putting times in the future because it's based off of the real time of the clock of the computer or the iPad. So we're going to ignore that this only says 1 minute right now because that's based on real time and we did a fictional time. All right. Now, after we're taken for labs, we can say we were placed in the room of, say, at 12:30. That means we spent 5 minutes in the lab. And it says -8 minutes because, you know what? Let's do it this other different way. Let's say we checked in at 11:20. There we go. So we checked in at 11:20. Nope, that still didn't. Okay, now we're good. And we were taken for labs, we'll say at 11:25. So we waited 3 minutes for labs. And then we'll say we're put in the room for the doctor at 11:30 p.m. All right. I'm not sure why this is a negative number yet, but we're going to find that out in a minute. So we're going to say that the doctor arrived at 11:45. So now it says the wait for doctor was only 15 minutes. The total wait time that we waited is the 15 minutes for the doctor, and we waited 3 minutes for lab, so that's a total of 18 minutes wait time. Right now it says total time with staff is only 5 minutes because we're still technically with the doctor. So let's go ahead and clock out. Oh, that's another reason. This was set to PM. AM. AM. There we go. That's better. And this is AM. There we go. So right now it's saying total time in office is, again, is 62 minutes because that's based off of real computer time. All right. So we're going to go ahead and check out. We'll say at 12:30 p.m. So we spent a total of 15 minutes with the staff, a total of 18 minutes waiting. Technically, it would, and now it's saying total time in office is 68 minutes. So, and you can enter your vitals. You can enter whatever chief complaints you want. If they gave you the medication here, you cannot click on this white box because this is auto-generated. But let's say she gave you a new prescription. We could just hit new prescription. It brings up our prescription menu. We can go ahead and type in a prescription name. We'll just do a generic one. Over the counter, 81 milligrams. And we're going to take one tablet once a day. It automatically changes it to currently taking. It puts in the date because it's today's date. So now we can go ahead and go back to patient, and now it'll auto-populate you're taking 81 milligram aspirin. You can enter any notes you have here. Any treatment recommendations from the doctor you can put in here. If you know the doctor has given you any notes or messages, you can also put it in there. If you have a copy of your visit checkout, I'm just going to use a picture. You drag the picture, text document, or whatever there, and so you can have a copy of the visit checkout. If you're in a state that allows you to record your office visits, you could actually put the audio recording in here as well. If we go back to patient, we now have that visit complete. So if we go into visit, it's not going to be listed anymore. And if we go back to main menu again, it's not going to be listed anymore. And this is messing up a little bit. That's because I just changed the program right before we started this, and for some reason, right here, I think that's what's doing it. So we're going to go ahead and go transparent. Whoops, didn't mean to hit enter there. See if that fixes it. Yep, that fixed that. Okay. So there are no appointments today, no future appointments scheduled. Okay. But now let's schedule one for this patient. We'll do it the other way. It will not auto-populate the address, but we'll do it this way. We could go visit, add new visit. You select the date. We'll go July 1st, and we'll go at 12:27 p.m. Again, we can pick the provider. It will only list the providers that are assigned to this patient. And we'll go reason for visit, checkup. All right, now if we go back to main menu, now you're going to notice that it says there is one upcoming appointment in the next 30 days. And it lists that appointment. Let's go back into this patient, because there's a lot of this program is very detailed on the information you can enter. Let's go into medications. That's where we have a list of medications. We had the aspirin that we entered. That's already in there. You could also hit display current medication. It will give you a pop-up with a list of all the medication that this patient is currently taking. You could click on preferred pharmacy. It says there is no preferred pharmacy on record for this patient because we never entered one yet. Would you like to add a pharmacy now? If we hit cancel, it just closes out. If we hit continue, it brings us to the pharmacy page of the system. So we're going to go ahead and hit Walgreens. And we're just going to go any address, any city, Florida, 12345, and a phone number. I'm just making up fake phone numbers. If they have a website, you could enter that. And when you're done entering the pharmacy, you can just hit close. All right. Now, if we were to type in click on preferred pharmacy, it brings up the pharmacy that we did. Now we could just dismiss it when we're done looking at the pharmacy. Or if we needed to, we could go ahead and edit the pharmacy. Family history. Let's do a couple of these top tabs first to get them out of the way. Family history. This is just a multi-text box that you can type whatever you need to. And then when you click on it, it's going to be there. Condition list. The condition list is a little different. If you have if the patient has a medical condition, you would hit new condition, put in the date they were diagnosed, and the condition, a excessive dreaming and the provider that diagnosed it. Now, if we go back to patient, now that condition is listed in the condition list. You click it again to take off the condition list. Social history, again, is just another multi-text box. Dreams too many times a day. So you could type in whatever you want there. It's just a multi-text box. Emergency contact. That's a little different again. Do you want to display or edit emergency contact? Now, if we wanted to display Dreamfinder's emergency contact, we would just hit display. Because there's no emergency contact available for this patient yet, because we never entered one, it will tell us no emergency contact entered. Do you wish to enter a contact now? You have the options of yes or no. If you click no, no contact is entered. If you click display and we click yes, it now displays the emergency contact information where we can enter. We'll just go, let's see, trying to think of a fictional name. We'll go Mickey Mouse. It auto-populates the full name. The relationship is a drop-down field. You have husband, wife, mother, father, son, daughter, brother, sister, pet owner. We will get to in a little bit. So we're going to just go ahead and hit father. Again, enter a phone number. Just typing in the numbers, no dashes or spaces. Otherwise, it will mess up the format. Again, type in their email address. And it auto-populates that. Now, if the emergency contact is in the same living space as the patient, you could just hit address same as patient, and it will auto-populate it. Now, if the emergency contact is in a different location, you click that off and you can enter their actual address. We're going to leave it same as contact. Get out of that, we're just going to hit the green box on the emergency contact. Now if we go to the emergency contact and we hit display, it will display Dreamfinder's emergency contact. So we covered medications, we covered visits, okay? Surgeries. If they're having a surgery or procedure, you could do it, again, two different ways. We could do it through this one and just add a new procedure and pick the date, the procedure, the provider, if it's an implant, if there's any results. Notes is a multi-text field. These are all image fields that you can drag documents or photos over. I'm trying to find one. Okay, here's a PDF of this random ATS load order for one of my games. So when you click on it, a document, it will load up the document. On a Mac, it will load up through preview. On the iPad, it will just automatically show up. All right. We're going to delete this one for now because we're going to show you the other way to enter a procedure. So we're going to go ahead and go into provider and say that Figment is going to do a surgery on Dreamfinder. So we're going to go ahead and schedule visit for provider. And we're going to say today, and we're going to go say 1 p.m. Reason for visit, Dream implant. All right. Again, you can enter the length if you know it, but whatnot. But in this case, instead of hitting back to patient, we're going to scroll down and we're going to add to surgery procedure list. Now that automatically brings up the same window we were just in, the surgery procedure with screens, but it auto-populates the date, the surgery or procedure, and the provider. Then we can go ahead and either click back to patient and back to patient. And we'll go back to client. Now, if we go back into surgery procedures, we have that surgery procedure there. We go back to main menu. The appointment's already there as well. Now, when you do it that way, though, if you have to update anything in the appointment, once you schedule set it to a surgery procedure, it does not automatically update that. So to update anything on the procedure, you would have to go also back into the procedure and update it there. All right. Now we'll go that. So that's surgery and procedures. Okay, attachments. There's many different types of attachments you can enter. We have all attachments. If you have a bill, a regular document, emergency ER, which is emergency room discharge, forms, imaging, information, medical records, progress notes, receipts, test results, visit summaries. So we could go ahead and add one here. We're going to pick today's date. Description, you give it whatever description you want. We'll say bill or procedure. And we're going to pick the Dream Find Figment. And you notice it says Figment Imagination, but it also says that he's our primary care physician because it took that information from the provider menu. Document type, we'll go imaging. And we'll just drag an image over from our desktop. Now, if we go back to patient, it doesn't show anything here. But if we come here, we have two options. We can go view all attachments, and it will list every attachment you've entered into your system. Or you can go ahead and go, since this was labeled as imaging, if we go imaging, it will just bring up only the ones that are marked by imaging. Again, we can also search by the provider, depending on how many attachments you have. We can limit it to the provider. Medical implants, if you or one of your loved ones that you're using this system for had any type of implant, you could go ahead and add the implant. Now you notice that since it's a medical implant, those are pretty important, so it is a red background. We could go ahead and enter the date, device or description. We'll just say pacemaker for the sake of it. Who implanted the device? If you know the reason, we'll just say heart issues. Location of implant, we'll go left upper chest. And we can hit close window. Actually, we don't want to hit close window. I'll have to fix that because obviously that was an issue. If you ever get to these tables like this by accident, all you have to do is click this little white square on the top and hit main. It'll take you right back to the main menu. We'll go back into patients. You know, it says medical implants. It's got the pacemaker we just put in. If you don't remember to click here to take off medical implants or any other menus, you could always hit reset menus and it brings you right back to the main menu of that patient. You could add vaccines list. We'll show you any vaccines they've gotten. Or you could add a vaccine. We'll go, and it will have the generic vaccines that most people get. I do have to maybe enter a way that you guys add. Oh, I do already have that. Okay. So if the vaccine is not on this list, you could type in add new type of vaccine. It's going to bring us to the vaccine database. Dream infusion. If it's a pet vaccine, you will want to click that. That's very important. If it is for a pet, you want to make sure you click pet vaccine. Now, if we come back here, we can go ahead and look. The vaccine we just entered is now in the list. So if we go back to patient and we go to vaccine list, he's now gotten the vaccine of a dream infusion. If you have to call your doctors or whatever, same thing. Right now, there's no information entered. But if we could add a call to the doctor. Again, you can enter them this way, but the best way to do it for a better integration in the whole system would be to go to provider, the provider you want to call, and hit log new call here. Automatically puts the phone number and the provider's information there. You then pick the date, the time of the call, give it a reason, follow up, or whatever. I'm just going to randomly type letters. Method of contact, phone, email, text, or in person. We'll go phone. Type of contact. Now, do you have a complaint, a compliment, a fax, a medical question, requesting appointment? I really need to add request medication refills or other. So we'll go medical questions. It's going to say make sure to toggle active call off and back on to set call to actually not active. All right, I got to change the wording on that, but right now, so this call is not active right now, but it's still a logged call. So let's go back to patient. As you can see that we're in the provider menu, and it lists that we've called this provider before under the provider menu. We also could show it under the notes section. The notes section will log every call to, it doesn't matter which provider it is. All right. Now, if we go back to list of patients, okay. Oh, we actually, it's showing you these menus because there is an appointment today. That's why these are down here. Now, if we go back into that call, and we make this call active, and we go back to patient, you notice we have another button here now that says active call. We click on that, it will automatically, it should have automatically entered into the call. I don't know why it didn't do that. Let's try that again. Yeah, it's just showing you the list of active calls. And then you can click the correct active call. But you also notice on the main menu on current patient, Dream Finder is now highlighted in yellow. Yellow representing an active call. You could also click active calls here to get to whatever calls that are active. So if we take off that it's no longer an active call, Dream Finder is no longer highlighted, active calls here no longer shows up, and active call here no longer shows up. All right. I'm not going to go into all the details of every single part of the system right now, because I don't want this video to be too long. It's already 34 minutes. But you could do the same thing with any bills you get from the doctor, your insurance cards or insurance information, your referral systems. If a doctor refers you to somebody, you have a bunch of different test results that you could pick from and enter information from, mostly blood work. All right. But what we want to do now is I want to show you one other thing. Oh, actually, let's select the Dreamfinder's color. We want to make Dreamfinder's color choice purple. Because now, if that he's purple, we go back to list of patients. If we go and bring up our calendar, his appointments are listed in purple on the calendar. Let me see. We'll go month. Okay, so he's listed in purple because that's the color we picked for him. Go back to main. We're gonna add one more patient because I want to show you the other options that are available. All right, so this patient we're gonna go, and I'll use my dog for the example, Chandler, and Finder because he's Dreamfinder's dog in this example. All right. Again, we could do a date of birth for him. We'll just randomly select a date. So Chandler's 7 months old. Chandler, we're going to go ahead and pick a nice blue color. But this time, we also want to make sure that we are picking pet. All right. Now, when we pick pet, additional options appear. All right. You notice it now says last rabies certificate, which we don't have one for him yet, obviously. That's why it's not doing nothing. So you could enter phone numbers, the same thing as we did with Dreamfinder, drag a picture over, enter their phone numbers or whatever. All right. Now, if we go into providers, he has no providers because the Figment that we added as a provider for Dreamfinder does not show up on a new patient. So we have to add a provider for him. And we're going to go ahead and type in any provider. All right. So we'll go back to client. And now you notice we have two patients, Dreamfinder and then Chandler. We go back into Chandler. And we're going to go ahead and go to provider. We're going to go ahead, click his provider, and we're going to go ahead and schedule a visit. We're going to say it was for today, and the time is now. We checked in now. All right. We're going to go back to main menu. Now you notice that Chandler is in purple, meaning that we checked in for our appointment. That's what these bars down here mean, so you can keep track of your appointments. If we say he was taken for labs now, and we go back to the main menu, it now switches that he was taken for labs. And if we put that he was placed in the room now, and we go back to the main menu, it's now noticed that he is in the room waiting for the doctor. And if we say the doctor finally has arrived, and we go back to the main menu, it now indicates that he is with the provider. All right, and we're going to say that this provider went and treatment recommendation, we'll say gave him his rabies vaccine. All right. So now we're going to go ahead and hit checkout. We go back to main menu. That Chandler's appointment is gone and no longer highlighted because he's done his appointment. We go back into Chandler. We're going to go ahead and add a vaccine because he got his rabies shot. So we're going to say today. And we're going to go ahead and we're going to say it was a 3 years rabies vaccine. And the provider was his current vet. If you know the dose and lot number and manufacturer, you could go ahead and enter that. If you know the rabies tag number, you could enter that. This is good for 3 years. When you hit that it was good for 3 years, it's going to auto-populate the date that it expires. Now, if we go back to patient records, you're going to notice, oh, look, his rabies is now current. And if we brought up the certificate, Oh, actually, let's go back into his vaccine list because we did not actually enter. We did not enter his. Did not add a vaccine that he vaccine for him. We didn't add a paperwork for him. So let's go ahead and put in document. So that would be where you would enter his rabies certificate. Now, if we go back to patient, back to patient. All right, if we click last rabies certificate, it's going to bring up that appointment and it show his doc and it show the doctor document. So that's the basic basic functions of this medical database that I designed on Ninox, which is good for, again, for a Mac or iPad, and they do sync with each other. If you are interested in me going into further details on the other parts of the system, please comment down in the video down below. If you would be interested in receiving a totally blank copy of this database for your own use, please also send me either leave me a comment down below, or you could click on my contact information and contact me through there, and I can send you a copy of this blank database. Thank you for watching. If this video was helpful, please remember to hit that likes button. If you are new here, also consider subscribing for more reviews or tech videos like this. And have a great day.